I'm still setting up. I will start up as soon as the software that does the subtitle is set up. So I set it up, and then it says that it doesn't recognize a microphone, which means I have to restart the process. So okay, restarting the process. Hi, this is Dr. Yun Han Kim. I'm an expert in integrative medicine and functional medicine, as well as low dose naltrexone or LDN. This is my pop-up LDN and functional medicine Q&A. So if you're a guest, please uh, type your questions in the chat, and, and then I'll do my best to answer it. Um, so my my visit with the LDN, actually the LDN, what happened to me, that a patient of mine asked me to do research about 20 years ago, and I decided to do it and found that there are more potential benefits than risk. So I went ahead and um, started to prescribe LDN, started to learn about LDN, and I'm grateful to that patient because 20 years later, I have achieved a level of expertise for LDN, and I'm able to help a lot of people using LDN. And I'm doing the pop. I do regular Saturday, Friday evening school live sessions. In Facebook, it's a pop up, and it's a pop up because I don't necessarily want to commit to the schedule, because Saturday morning is really valuable time for family. So Saturday evening, everyone is, or Friday evening, everyone is pretty much disengaging from the week. So that's what I do. Do you have, if there's any questions, go ahead and type it in. Otherwise, I can start looking at our blog and answer questions. There was a question about is LDN a can you get hyper on LDN, hypo and LDN? I think this person is was asking about oscillating. The can your disease oscillate, go back and forth when you take LDN? And I did research, and I just could not find any views uh, to really um, support that view in research. But I know that in clinically there are people who just don't tolerate LDN, it has an unpredictable value. Now, the oscillation I have seen on one person on thyroid, where the thyroid was it was the process was so inflammatory, and the thyroid was going in and out of hyperthyroidism and hypothyroidism, and at the end of the day they had to remove her thyroid, and then it got better. So LDN is a wonderful tool, but it's a tool, which means that it's got limitations. And in 20 years of prescribing LDN, I just keep on learning more um, about the benefits of using LDN. So Tammy has a question about 4.5 milligrams of LDN for inflammation, and cholesterol numbers got improved by 100 points. I'm really happy to hear that, that there's not a lot of known about LDN and cholesterol at this time. So I think that, and what's important is that when we don't know, rather than saying not knowing, I think the best thing to do is to just talk about it like we're doing, and other people can also talk about it, and then they will get more ideas about what the value of LDN would be for them. But I'm so happy to hear that the officially LDN is not a proven cholesterol lowering agent, and but that the clinician one clinician said that they have not seen a lot of LDN lowering cholesterol, and so the one thing they note is that it may be indirect effect when thyroid function is low, because usually when cholesterol, if thyroid is out of whack or out of balance, then usually I tell people that cholesterol numbers are not as reliable, because thyroid, you have to optimize thyroid first. So so I think that I think that what happened to individual is really valuable, and it's true. But just evidence wise, it's just I cannot guarantee. I couldn't say that. And we're on Facebook, and Facebook's pretty strict about sticking to evidence based, rather than, and this is health related. So that's another reason. And I will post this to the Facebook group, so it has to follow the Facebook rules. And I'm using Facebook softwares, Facebook platform, so just have to follow the rules. So the other thing that I'm seeing is that I'm seeing in my practice that patients are becoming more endorphin depleted than ever, and that means that our patients are getting sicker than ever. And along with that, I'm seeing MCAS becoming really a big part of my practice. MCAS is mast cell activation syndrome. And I can say that last several patients that have sought my help, all of them had MCAS. I have a very, I feel very blessed because I have a practice that is small, by purpose, because on purpose it remains small, about 99 active patients, and I take about 2 new patients per month. And the reason for that is I want to do my best for my patients. I don't want to get squished, or I don't want to be forced into practicing in a sloppy way, which is, I think, very common in the current medical system. I know because when I go get care, that's what I get also. I mean, there's not a special doctor that takes care of doctors. We get what our patients get. And I hear a lot from my patients that when they say mast cell activation syndrome, unless they are specialists or they know about it, there's a level of dismissal, in sometimes, and sometimes patients feel, share with me that they feel gaslit, and that's very unfortunate. I'm reminded of a situation when I started practicing medicine, or was in medical school in the 80s, that my teaching physicians would say, Dr. Kim, do you believe in fibromyalgia? Now, today, I don't think any doctor would dare saying that, but at that time, they felt that fibromyalgia was one of the things that, it wasn't real. And and their idea was that it's not, there's no labs for it, there's no imaging test. But we do know, like, good relationship, love, um, those are all things you cannot see, but people who are in love know what love is. People who um, are really in relationship know what love is. So I think fibromyalgia and pain cannot be measured. There's no lab test that can measure, and whatnot. Um, so the other question, follow-up question from Tammy is, can you be an LDN long term? I think so. I think that in any immune modulation recommendation is about 5 years to see what it does. Now, that's not what happens. Patients do what patients do. Patients start LDN, patients get off on LDN, and that's that. So there's a question from Nata. Are nightmares a part of LDN side effects? Yeah, of course. Vivid dreams are promised when people have what you call nightmares. I think that but what I tell people is that, do you have issues with nightmare? Have you had PTSD? Have you had bad things happen in your life? And people say yes, then usually in my patients, I tell them to consider um, taking um, taking it in the morning, taking it with lunch or dinner, and the dinner because if you eat 4 hours before sleeping, the amount of the LDN half life is about 4 hours. So that solves that issue. I put in my blog. It's free to sign up, and it's my what I call the master blog. That I have several blogs, but I usually publish here everything, and then it also delivers everything to people's email. So, and I only put things that are interesting. I don't do a lot of advertising of my own practice because, like I said, I have a small practice, 99 active patients, 2 patients per month, which is the ones I accept. And I'm grateful because I do get those 2 new patients that and as a matter of fact, I'm taking some time off in May, so I'll probably um, reopen my clinic, taking new patients in middle of May, probably. So um, let me see if I can go to another screen. So if I look this way, it just means that I'm looking at another screen to check um, what what questions came in through Facebook. So um, so I wrote basically I did yet every week Friday 6:30 p.m. Central Time. I do a live through a platform known as School, and and that's something that is something that's very interesting. And I have that's the article that I have written as a result of yesterday's school live session. And the title is called One Dragon at a Time, a clinical framework for navigating chronic complex illnesses. I think that this is what I've learned is that there's a tendency when patients have very convincingly difficult condition that they want to try everything under the sun. Uh, the difficulty with that is that under the sun doesn't work very well because under the sun means that you don't know cause and effect. And and oh, so the dose question is a good question, Nata. So read this article because and that's what I was talking about when I first opened the live communication is that more and more our endorphin, my patient's endorphin reserve appears to be lower and lower. And another related question says, is there a way to measure endorphins? And I think that, yeah, I think of course endorphins can be measured and beta endorphins can be given to people, but I think it's just a matter of um, affordability. Um, and there's not one endorphin. So if you go for a panel, I think easily it can be thousands of dollars. And I used to run panels that were up to $5,000 at a time, um, and and I think that they do have testing, beta endorphin testing, but it's not a routine lab, and it's hard to interpret because what you have to do is measure in beta endorphin in multiple population, and that actually um, is a you have to get the population value and then you can get the reference value. Otherwise, you get a point, and point is not a data. Point is not helpful. Point is not useful to create a data if you have at least some line, maybe 20, 100, and the more the better. And we call it population versus sample true mean. And if once we know that, then we can come up with a reference. But it doesn't really matter because everyone's individualized. That's what I've learned. So this article that I have is just finding your LDN sweet spot, a simple guide to optimal testing available from my blog. ifmsynergy.com. That's something that is very, I think it's very interesting. So, and there's a table that shows the what I call Kim LDN optimal dose questionnaire is very helpful to um, look at the where you should start. And basically, it asks a question such as, are you medication sensitive? Are you highly functional in daily life? Have you been ill more than 6 months? And so those are all 10 points. And there's, if it's like the first question, are you medication sensitive? Yes, means you get 10 points. Are you highly functional in daily life? No, 10 points. Have you been ill for more than 6 months? Yes, 10 points. So if you get 30, then I tell them to start at 1 microgram. If it's consider starting at 1 microgram. If it's 20, I tell them to start consider 10 microgram. And then if it's they are 10, then I tell them to start 0.1 milligram. If the point is 0, then I say then we can start wherever you want to start. But I've seen people. Um, let's see. Why do people react horribly? I'm so here's the situation. Why? I think that after COVID, number one, I believe that everyone's immune system has seen COVID virus one way or the other. Even you didn't get vaccinated, unless you lived in a like a bubble. And even then, I think if people come in and out of a bubble, then you would have gotten it. And if you are living in the society now, there are COVID viruses. And I think that our immune system has interacted with, and the level of mast cell activation syndrome or immune derangement is very high in the population, and the consequently our endorphin levels are probably historically low. And I've heard this when I first started my practice, maybe about 30 years ago. And I see it 30 years now that people just are not as resilient. So the question is, why is it this way? Ask yourself a question, Shar. Is your life less stressful now than 30 years ago? Maybe you're not 30 years old. But what is your life more or less stressful than 10 years ago? I would say our lives are getting more stressful. Our job expectation is going up. There's also a lot of pressure with the AI now. Even having a job is not assured for everyone, especially youngsters. So I think that's the reason. I think, and then there's questions about those things. So that I want you to go to my website or the blog site and read. And this is on functional medicine and LDN. So that the answers to a lot of your questions are there, and that's why I do that to maintain. Um, I probably publish 1 or 2 articles a day. If someone writes an interesting thing, I do research, and if it's interesting, then I publish it. So why can't I go over 1.5 milligram? Because of endorphin deficiency, um, and and that means that you have to increase endorphins another way, or you have to start addressing root causes of your illnesses. And what I see in these, especially in LDN panel, is that there's the idea that LDN can do everything. LDN is omnipotent, and it isn't. Even with LDN, there are some things that can be done and some things that you have to do. So in that, we say, is LDN enough, or is LDN necessary? In most cases, LDN is necessary, but it's not enough by itself. So we have to do other things, and that's where the functional medicine for me comes up. The functional medicine allows me to do expanded testing. The way that I have my practice, limiting number of patients to 2 new patients per month, um, it assures that I have the time to spend time with my patients. Um, so um, that's that. And then you know, here the question of zero on the dosing is irrelevant because I have like this last 2 weeks I had several patients I had to um, ask patients to go below 1 microgram, 10 nanogram, and one person was ambitious and they tried 200 nanogram or zero point 0.2 microgram, and they 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 really were doing terrible. And then I said, cut back to what I asked to do, go to uh, 10 nanogram, and then the person's like, oh, that's so low, but it's really making a huge difference in my life. So I thank you for your blessing, Nata. So I do allow. I've been pondering and researching this a lot. I practice in the United States of America. I am licensed in Iowa, Illinois, Missouri, Georgia, Florida, and Texas. So in the U.S., I can only um, take care of these people. In Canada, it's a little different, and or outside the U.S., I'm told the rules of engagement are different. They have to know that I'm not providing medical care, but if people wanted to connect with me one on one, there's that possibility for a fee, of course, and they have to sign that they know that it's not a medical. They're not looking for medical care, and they have to have their own doctor. So that's that, and then so LDN, I have known because I used to in the U.S. We have socialized medicine known as Medicare, Medicaid. Medicare is for older people, seniors, and Medicaid is for poorer people. And some of my patients have asked me, I can't afford it, the compounding fee. So then I tell them to look it up, how to dilute 50 milligram, and then I prescribe 50 milligram, and they dilute it themselves, and they're getting great results. So um, so that's Alice. That's just the thing is that there's a video I want to share with you, but no, I think that if someone says that what Alice is saying that it's not enough, then remember I said LDN is necessary, but it's not enough. Then it's time for using for me functional medicine tools to help people. And I have another group known as root causes. Um, Let me find my root causes group because that's a group that you can talk about different things. Um, Functional medicine in LDN group, I don't allow that to people to do that um, because there are rules and I can get in trouble. So so let me see. So if you have TNF alpha and cytokine tryptase 16, so that's I would say this if someone has that kind of lab, they show me, it's likely that they have MCAS. And I have an article written on that. Let me find it and put that up. And that's why I do the blog, and I end up sharing my blog articles with my patients also because I feel like it's there's so much illness out there, and for me to do it just makes a huge difference. So is LDN compatible? uh, Nicoletta, that's a great question. In my practice, medicinal mushrooms are used. You have to be careful because some of the medicinal mushrooms are, I mean, they are immune modulation modulators. So when they're immune modulator, some of them will actually immune suppress. Some of them will um, immune modulate. Some of them will immune simulate. And when you say medicinal mushroom, there's not just one. There are many, 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 many. So like one person wrote Sakano. Sakano actually is a product of Tonkat Ali and Reishi. And some of these combination products can be problematic because you don't know what's doing what. So I usually, in my practice, like to separate it unless patients say, hey, I need a care that is, I'm taking 40 pills, I don't want to, then I try to compromise. But if they don't have to, I think doing it separate is a good idea. Um, and then Nata says prolonged stress accumulates. So I'm unsure that's the truth. I would say that um, that like the person who said they have sky high, uh, this person has MCAS, and even if they don't have to do anything, any other further testing, the person has already done cytokine testing, TNF alpha testing. You can do more testing. There's always more tests. But the thing is, you just have to get them better. I think they have a saying in the West, proof is in the pudding, and I'm a big believer of that. Outcome is really really important. Um, so that's what I would say. Let me go look if there's more questions. LDN will reduce die-off while on antibiotics. I'm not sure. Lyme, I have another. I think I have something on Lyme too, but basically Lyme will trigger MCAS in some people. The Herxheimer reaction is an example of MCAS kind of reaction where immune system has been compromised and die off. So I don't think you're talking about die off, Nicole. You're talking about Herxheimer reaction, and LDN can help, but there's no guarantee. Lyme is a very very potent and capable opponent, and it individualizes and it punishes the person patient wanting to get better when they take too much of antibiotics or too much of anything. It can happen with herbs, it can happen with antibiotics. And what I can say is that LDN in my practice is the cornerstone of the treatment because it can normalize the immune system. So so there's a question about I'm using high doses of zolpidem. Is LDN safe? So that's a question that you have to ask your doctor because that's a medical question. And I know the answer, but I cannot answer that because the moment I do, then the Facebook will say I'm giving medical advice. Now, it says my nervous system is already dysregulated. That could this combination, and you have to understand the mechanism of LDN. So I would say, let me go ahead and um, find and the first question I cannot answer. The second question I can just talk about if LDN and zolpidem has a reaction, likely of reaction. So I will. High doses of zolpidem is a problem because all of those medications helping to sleep is likely to be a um, benzodiazepine or GABA related, um, and those are easy to get um, tolerant or even addicted. But the mechanism is quite different of the two medication, and this is kind of why I take a lot of time to see patients. Initial visit up to 90 minutes, follow-up visit up to 1 hour because you just don't know. And so this has a lot of yeah. So I think that the idea would be that the if you're in high dose zolpidem, that's a red flag for in my practice. That's a problem, and that person may be also having um, insomnia. One of the reasons the symptoms of MCAS is insomnia, and then when they take to test that, taking a Benadryl like medication, the older medication is very helpful because then it's going to calm down the the brain and then it'll give answer. What I tell my patients for sleeping is that you need to stop. Um, you need to stop taking. You can't be on sleeping pills 7 days a week. I always share with my patients. My approach is 3 days of solid sleep and try to maximize on behavior. So I had insomnia visit me, so I increased my physical activity throughout the day to maybe about 9,000, 10,000 steps, and then it reset everything. Um, and the next question is, so Nicole's question: would you wait a few months and noticing a difference between LDN before starting antibiotics? Again, it's a medical question, and because you know, it's I can only offer medical advice to my patients, um, and so usually LDN. Once I start patients on LDN, I find a sweet spot and stay there, and with the antibiotic, it doesn't. I think one of the things that about difficult about Lyme disease is that you do have to understand that likely you're not going to clear Lyme with the current level of medical technology. So you can put it to sleep. So the way I explain it is think about the idea about the thing called tuberculosis, which is also a very difficult, respectable challenge. And what you can do is you can not eradicate it, you can calm it down, you can inactivate it. So in my practice, Lyme, I try to inactivate and control make the immune system healthy, check, make it difficult, hostile environment for Lyme to flourish. Otherwise, they're gonna get neuro Lyme and have all kinds of issues. Um, the other part of this is that does hydrochloro that's a medical question. So you ask your doctor who's prescribing that, or you do your own research. Um, with LDN, I know these answers top of my head, and this is an LDN group, so it's appropriate, and I'm an LDN expert, so it's appropriate for me to talk about LDN. Other things, you will need to do your own research. So one person said I have increase in heart rate variability is a good thing. Is it normal? I don't know. That you have to understand that the ability for us to have these devices is a recent phenomenon. We'll get more data, and more people will say. Um, so that's the thing. So LDN and insomnia, I have not seen it, but in the beginning of my career, now I would say about 50% can get insomnia. And so, again, I did say that our immune system has changed. And people who get insomnia, I am more suspicious they may have like a subclinical MCAS. So, so the overstimulation issue should be taken care by other means, not just zolpidem. Zolpidem can be useful, and now in that dose, it's very much possible that that person's body is requires it or is tolerant to it or is dependent upon that. Um, LDN. That's possible that this person has started uh, statin, and when they stopped LDN for a week, then muscle pain came. So you will need to talk to your doctors. Muscle pain and statin is a big problem. Once you get it, it doesn't go away, even when you stop. So you need to talk to your doctor about it. So if you give me questions that's regarding LDN, I'll answer it unless you're trying to get me to answer the question. If is it this way or that way, medical visit, a medical thing. If not, I will do my best to answer the question. And the other thing I have to say is that school is a lot more respectful of freedom of expression. Facebook is very, very strict with what they want us to do. So this is it's a free group you can join called and school called school.com slash LDN support group. And that's and we have LDN support groups in Facebook. We have LDN support group in school. We have a website also, LDN research support group. And they all have the same logo so that people can tell that they're all related sister sites. And I'm thinking about actually pushing everything towards the my blog site, because I really think it just will make everything simpler for me, and simpler is really, really great. If you have more questions, I will stay on another 5-10 minutes. So Nata has a great idea. So here's the deal. There are conditions that require comprehensive approach. Fatigue, chronic fatigue syndrome is one. Long COVID is one, and MCAS is another one. Lyme is another one. You need a comprehensive approach. You cannot just say, "Oh, I'm taking LDN. It's going to be great." Maybe you're 1 in a million that will be that way. So in my practice, and that's why I love running our groups, because the groups help me to. What groups help me to do is understand that there are a lot of people with a lot of different responses, and that's helpful. So school group is really helpful because school, I have more freedom. But Facebook is great because Facebook is more popular. So I want you to understand that LDN is a cornerstone of many treatments, but it's not the only thing. It is necessary, but it's not enough. And I just want you to know that. So if there are other questions, I'll stay on and answer. And that's why I also do pop-up question, because if I announce it and too many people come, then it would not be as valuable. So to summarize, I'm noticing that more and more people are endorphin depleted, and that is unfortunate, and because it makes it more difficult for those individuals to just go to anywhere and get the appropriate dose that's targeted for them. And there's not yet a test for endorphins. You can measure it, but you don't know what that means. The person said, I gained weight. Gaining weight or losing weight, I think that it's very complex. And again, LDN, there's Contrave, which is LDN combined with another medication that's for weight loss. So I'm unsure that weight, but I have seen that. I've seen people saying, I lost weight, I gained weight. And I think that is possible. And possible doesn't mean it's and one person wants to join. So one person wanted to join our group from here, but I have to decline them because they didn't answer the question. Our group almost got shut down. We were suspended twice. So now we're very strict following Facebook rules. So if anyone wants to join, you have to say, I agree with all the rules. If they don't say they agree with rules, or they skip some rules, then we just automatically reject them. Some exceptions exist. If we feel that they're not English speakers, then they just probably not knowing what they are. So yeah, we want to stay like there was a lot more LDN support groups. They're all gone, except for one, which is bigger than us, but they're not moderated, which means that they can get in trouble. And we want to be the last ones standing, because we feel like what we do is helpful for our members, and we want to continue to be around and help our members. So I just want to say thank you for joining me. Have a great Saturday, great weekend. Thank you.